Okay, there's been a lot of talk of healthcare reform within these past few months. And in order to have real healthcare reform, um, you're going to have a situation come about where the doctors are paid a fixed wage regardless of how many patients they see and regardless of how many treatments they administer. Because right now you have a situation where in psychiatry they're not really administering drugs in any sort of conscientious manner. What they're doing is they're prescribing as many drugs as they can for as long as they can because that's how they get the most money. So if you had a situation where they were just paid a fixed wage, regardless of how many patients they see, regardless of how many treatments they administer, um, you would have a situation that was a little bit better, a lot better, really, a lot better. Because right now it's just the mental health system doesn't really help people with mental. It doesn't really help people. Uh, they have an over reliance on drugs. They don't really talk to people much and help them with their situations or anything like that. It's just a mess, and it's really messed up a lot of people's lives. And so that's so yeah, the mental health system is a mess. Uh, as far as like the other aspects of the medical system go, um, there might be some stuff going wrong with that too. I haven't really investigated it deeply, but if you just have a profit-based system where the more people you treat, the more money you make, that's not really a recipe for good healthcare, Um, and you don't want to like look to drugs and pharmaceuticals for everything. You also want to explore other forms of treatment. Whatever's best in whatever situation is what you want, but you can't rely exclusively on pharmaceuticals. That just doesn't make sense. And so that's what you need to do for healthcare reform. Um, and it's the same thing that you need to do for reforming the police, because you have a situation in a lot of places, maybe all places in America, but at least a lot. I'm not really sure if every place is like this. But you have a situation where police officers are rewarded for uh, the more people they arrest. The more people they arrest, the more money they make. Now, how can you an effective job as a police officer if you're just gonna go around arresting people all the time? Because like, what if you're in a situation where you really don't have to arrest people for like, say, a month, and then you get punished for using proper discretion? That's stupid. So, police officers need to get paid a fixed wage too, just like doctors do. Otherwise, you have crazy stuff going on, and so, and I think that the way to implement that sort of thing is through a socialist system. Um, it's possible to implement it within a capitalist system, but at the same time, within a capitalist system, there might be many interests that work really hard to undermine that sort of deal, the sort of fixed wage deal, So if you really want to make sure that that works right, I think you might have to go the socialist way. It's possible to do it within a capitalist system, so I'm not excluding that. But yeah, this is what you want to do if you want healthcare reform, and if you want reform in the law enforcement, as well as you need like independent bodies to like oversee um, police departments and their actions and stuff like that too. Because you can't really have the cops investigating themselves. That doesn't make any sense either.